Do you know about arthritis? Arthritis came from the Greek word arthron, means joint. And itis means any type of inflammation. So, arthritis means inflammation of joint. Now let's know what a joint means. A joint is a junction of two or more bones. For example, knee joint is made by lower end of femur and upper end of tibia. So knee joint is made by two bones. Your wrist joint is made by lower end of radius and ulnar with carpal bones. So, this joint is made by multiple bones. Arthritis can be divided in many ways. According to the presence of inflammation, it can be broadly classified into inflammatory and non-inflammatory group. The inflammatory group consists of rheumatoid arthritis, gouty arthritis, septic arthritis, reactive arthritis, psoriatic arthritis, juvenile idiopathic arthritis, spondyloarthropathy, arthritis related to systemic diseases, etc. The non-inflammatory group consists of osteoarthritis, which is a degenerative type of arthritis and usually seen in older age group. According to the number of joints involved, arthritis can be divided into three groups. Monoarticular arthritis or monoarthritis, when only one joint is involved. Oligoarticular arthritis or oligoarthritis, when 2 to 4 joints are involved, and polyarticular arthritis or polyarthritis, when 5 or more joints are involved. Arthritis usually presents with pain of the joint, swelling of the joint may be warm and red. If not treated, joints become deformed and stiff. Now, how do you diagnose arthritis and its type? Because your medical treatment will change according to the type of arthritis. First, we have to diagnose it clinically and then confirm with blood tests and imaging modalities. The basic blood tests are blood counts, CRP, ESR, thyroid profile, etc. In inflammatory arthritis, the CRP and ESR will be high. In arthritis related to systemic disease or autoimmune arthritis, hemoglobin will be reduced. We also need the special blood test specific for the type of arthritis, like serum uric acid level to diagnose gouty arthritis, rheumatoid factor and anti-CCP for rheumatoid arthritis, ANA for arthritis related to systemic diseases, HLA-B27 for diagnosing spondyloarthropathy, etc. We may also need X-rays, CT scan and MRI scanning in some cases to come to any conclusion and to see the level of joint destruction. Now, how do you treat the arthritis? Definitely it depends on the type of arthritis. Initially we use medicines to reduce pain and inflammation. These are medicines like acetaminophen or paracetamol, NSAIDs, steroids, etc. NSAIDs and steroids aid used to reduce the inflammation and so that the pain. These are commonly called painkillers by common people, but they are not. A painkiller is a drug which only reduces the pain, like tramadol. But NSAIDs and steroids reduces the underlying inflammation. You have to treat arthritis with specific drugs according to the type of arthritis. You need DMARDs or disease-modifying anti-rheumatoid drugs to treat autoimmune arthritis. You need uric acid-lowering agents for gouty arthritis, and so on. One thing you have to remember, the pain-reducing medicines to be used for short-term, but the specific disease-specific drugs should be used for long-term. We have to use braces, walking canes, walkers or even crutches to keep the patient ambulatory and self-dependent. We may use physiotherapy equipments like cryotherapy, ultrasound therapy, TENS, IFT, etc. to reduce pain. At the same time, patient needs to be trained with exercises to strengthen the surrounding muscles and maintaining the mobility of the joint. Intra-articular injections of steroids, viscosupplement and platelet-rich plasma are usually given. This is an intra-articular injection of platelet-rich plasma at knee joint. If the joint is severely destruct, then we have to go for surgery. The surgical procedures are fusion of the joint or arthroplasty, also called joint replacement. In long run, the patient has to do regular exercise and modify the lifestyle. The patient should not go for activities that causes more joint destruction, like squatting, stair climbing, etc. At the same time, he or she has to follow regular exercises and good activities like cycling.